Good morning. I want to thank everyone for coming here today. I'm Bob Hastings, the volunteer chair of the Alzheimer Society of B.C. To help mark the Alzheimer Awareness Month, we're here to officially release the National Rising Tide study. The report offers alarming statistics about the projected economic and social impact of dementia in Canada. It also offers possible solutions and hope. I'll mention that the Alzheimer Society of B.C. is the provincial voice for people living with dementia. We fund research and research in BC. We also provide the only province-wide network of programs and support services for people living with all forms of dementia. And we are an active participant in developing a provincial dementia strategy. In a moment, you will hear about the rising tide of dementia here in BC from our CEO, Jean Blake. Personal stories will also be mentioned from two individuals who have been impacted by the disease, a person diagnosed with Alzheimer's and a caregiver for someone that has Alzheimer's. Before we get to that, just a couple of housekeeping items. First of all, there will be a question and answer session at the end, and so if you could please hold your questions till then, we'd appreciate that. And secondly, for those of you with cell phones, which I assume is just about everybody these days, can you make sure your ringers are turned off? Our first speaker today is Jean Blake. She's the CEO for the Alzheimer Society of B.C. She'll now speak about the findings of the Rising Tide study and what it means for us here in B.C. Jean?
Thanks, Bob. Good morning. I'm pleased to see so many of you here today to join in the release of this landmark study, the first of its kind since 1991. A key challenge that's faced by Canadians and British Columbians is the aging of our population. As the baby boomers age and life expectancy increases, the proportion of senior citizens relative to all other age groups is on the rise. The first baby boomer will turn age 65 in the year 2011. To give you some perspective on that, the fertility rate between 1945 to 1965 was 3 children per mother. And after that, it declined to 1.5 children per mother. So the Rising Tide study gives us some very alarming statistics. And because of these numbers and the complexities that surround an aging population, this, of course, will increase a significant impact on healthcare and its cost if there are no interventions. The Rising Tide study tells us, with the alarming numbers, you can see up on the screen there, that within a generation, we will have an increase of 500,000 Canadians to 1.1 million Canadians living with the disease. And in BC, that will look like currently 70,000 British Columbians and increasing to 170,000. The cumulative economic burden, $872 billion in Canada, and it will be $130 billion here in British Columbia. So we're going to see an increasing demand for long-term care as much as tenfold. Dementia is already the most significant cause of disability in Canadians over age 65. It already costs society many billions per year. Over the past decade, the impact of dementia on the economy has become a growing issue, not only here in Canada, but across the globe. There are meager, uneven policies and enormous gaps in public health here in Canada, and so we need a national plan. The goal of this study was to generate a solid evidence-based foundation upon which policymakers can build a comprehensive national plan. The objectives included an estimation of the health and economic burden in Canada, as well as in specific provinces, including British Columbia, over the next 30 years if nothing is done. The report analyzes the possible effects of 4 intervention scenarios upon this burden, and it demonstrates how those proposed interventions could affect the health and economic impacts of dementia in Canada and in British Columbia, and how they could help to turn the tide. The report also reviews policy options and makes recommendations based on best practice on how to address these issues. Previously, when speaking about the prevalence and economic impact of dementia, the Canadian government and the dementia research community used statistics that were extrapolated from the Canadian study on health and aging. It was a unique landmark study, but completed in 1991, and although it had a longitudinal follow-up in 96 and has provided the basis for our understanding of the prevalence, incidence, and economic consequences of dementia to date, we are now almost 2 decades later, and the information learned from this study has become increasingly outdated. So the Alzheimer Society commissioned a report with funding from Health Canada, the Canadian Institutes of Health Research, the Public Health Agency of Canada, and Pfizer. Work on Rising Tide, the impact of dementia on Canadian society was begun. It was a 2-year intensive study, and additional analysis was also commissioned to determine the impact here in British Columbia. All results point to an urgent need for immediate action by all Canadians. However, we do want Canadians to realize, and British Columbians, that there is hope. There are interventions that can help, and in this study there were 4 scenarios that painted a picture of what if. The 4 case scenarios demonstrate how preventing or delaying the onset of dementia could significantly reduce the associated social and economic costs. Although the scenarios require further research to determine what is most effective and economical, they provide a strong direction. The study also provides a comparison of policies and strategies here in Canada as well as internationally, and it provides recommendations that are based on the best practices that were found. Although these are not definitive answers, we hope that they will stimulate discussion and action. Action around care, support, and the research needed in light of the escalating numbers. The 5 recommendations that are in the study, Rising Tide. We need to see an accelerated investment into all areas of dementia research. So that would include biomedical, clinical, quality of life, health services, as well as knowledge translation. The second recommendation is around a very clear recognition and support of the very important role that's played by informal caregivers, by the provision of information and education to them, support in their roles as care partners, and also including financial support. The third recommendation includes an increased recognition of the importance of prevention and early intervention for these diseases to increase not only healthcare professionals' understanding as well as that of the general public. And the fourth recommendation is around fostering integrated models of care that build on the chronic disease prevention and management framework and meet criteria for best practice in coordinated community care. And last, the fifth recommendation is really around strengthening Canada's dementia workforce. We need to improve diagnostic and treatment capabilities in healthcare professionals. We need to increase the availability of health professionals with a specialized knowledge of dementia, including geriatricians, neurologists, psychiatrists. We also need to make the best use of specialized resources that are available by utilizing more of a collaborative team approach and support patient self-management and caregiver participation in their own care. Also, we need to leverage capabilities of the voluntary sector through investment and training. The Alzheimer Society of B.C, as Bob mentioned, provides a great deal of support and education for not only those directly suffering the disease, but for their family members. So we need to make change happen. We want people to understand that while the coming wave of dementia is frightening, that there is still time to turn that tide. By investing in research and prevention, by educating and supporting caregivers, by raising awareness and ensuring that people are diagnosed early in the disease process, we can make a difference. I'd like to turn the attention now to the work that has happened here in BC. Although we have no national dementia strategy, the BC Ministry of Health Services recognized the impact that the rising tide is having on BC's healthcare system several years ago. They acknowledged dementia as a chronic disease, and in 2006, the provincial government funded the creation of the Dementia Service Framework. It was developed by a coalition that included the Alzheimer Society of B.C, the health authorities, the ministry, and had support from the BC Medical Association as well as others involved in dementia care. The Dementia Service Framework outlines 130 evidence-based recommendations that provide system-wide direction. Through the Dementia Service Framework, the BC government identified 7 critical gaps in dementia care, and you can see them up here on the screen. The government recognized that these gaps were significant and so provided a $1 million grant to begin the work to address these gaps. The Alzheimer Society of B.C. stewarded the grant, and all 5 of the regional health authorities and 2 universities led work on 7 initiatives, again that you can see on the screen, to begin work to improve dementia care here in British Columbia. These projects provided a significant start to begin addressing the gaps through increasing the expertise of health professionals in providing dementia care, through the development of a policy lens that could then be used to review and mitigate policy impact on people with dementia and their families, and as well recognizing the important role of the informal caregiver and then providing interventions on how to better support them. However, this work needs to be continued. As our population ages, this rising tide of dementia threatens to overwhelm our health and social systems. Sustainability of the investment in the grant is critical. Resources that emerged from the grant initiatives must continue to be used and promoted to ensure that we are able to change the culture of care, dementia care, here in British Columbia. Some projects have integrated follow-up into ongoing activities with staff and volunteers, while others continue to explore ongoing partnerships and funding opportunities. The economy has stalled government investment into these encouraging initiatives. We call on the BC government to continue investment in dementia care and to sustain and maintain the momentum in the work already undertaken. We ask all Canadians and British Columbians to call on their governments at both levels to take action now. We need our governments to rise to the challenge and to act on these recommendations. Further, we ask all Canadians and British Columbians to take individual action, to increase their understanding of dementia. As Bob mentioned, we have a wealth of resources on our website, alzheimerbc.org, and to take action for their own brain health. Thank you.
Thank you, Jane. Our second speaker today is Jim Mann, a person who was diagnosed with Alzheimer's in 2007. Jim, prior to 2007, or prior to being diagnosed, Jim held senior management positions in marketing, communications, and government relations, and was the CEO of a tourism industry association in BC. Today, he advocates on behalf of and for the people with dementia. And he does this by both sharing his story, and he's also an active member on the board of directors at the Alzheimer Society of B.C. Jim?
Thank you, Bob, and good morning. What a way to start the year. Thank you to all the media assembled here this morning to hear the economic realities of Alzheimer's and related dementias in British Columbia and Canada. The numbers that Jean just highlighted are startling, aren't they? Like the number of British Columbians with dementia today, approaching 70,000 people, and the associated healthcare costs of over $2 billion. Those and many of the other numbers mentioned by Jean are hard to fathom, but they reflect the reality here, today. The numbers are on paper and in the report. They are cold and stark. But you know what? For me, they are personal. I stand before you today a member of a select group of people. I am one of about 70,000 British Columbians. I have Alzheimer's, and I am under the age of 65. Whoa. Talk about a life-altering experience. Officially, this journey started in early 2007 at the age of 58. But there were clues much earlier. In fact, a year or so before, I had said to my doctor as I was leaving his office that we needed to talk about my memory problems. We didn't, until I forced myself to confront the reality. Ah, yes, the stark reality. The reality of getting lost. The reality of confusion. The reality of frustration. Like driving the car only to realize I have no idea where I'm headed, to the point of sometimes having to pull over just to get my bearings. Like forgetting what I had just read out loud. Like getting confused in what would normally be familiar situations. In 1 month in January 2007, it seemed to come together with a thud. Hence my doctor's appointment and the official start of this dementia journey, this almost 3-year journey. I need to make a point here because I know people can get concerned about their momentary forgetfulness. It is important to recognize that my memory lapses were not fleeting. They were not as simple as misplacing my keys or forgetting someone's name. My experiences were affecting my daily living and were increasing in number and significance. And the number of notes I was having to leave for myself were definitely increasing. As I said, it is now 3 years. So what does that mean on a personal level? Well, I've had to curtail some activities, but I've embarked on new ones. My company has officially been dissolved as paid work is no longer feasible. But my volunteer hours have increased where I am able to use some of the skills learned and used professionally. I volunteer with Alzheimer's-related organizations where I set my own pace and everyone is very patient. I have met others with Alzheimer's or related dementia at a support group I attend in my neighborhood. One of the Alzheimer Society of British Columbia's programs is support groups for people with early onset dementia. My group meets for breakfast on Fridays, where the day starts with good coffee and placing our breakfast order. We are like a family around the dinner table. We have good conversation and offer to each other sincere and helpful support, often from first-hand experience. It is a great way to start the day. To get to the restaurant, I take a taxi and then grab a bus on my way home. That, too, is a consequence of Alzheimer's. I am no longer able to drive because I decided my actions were not as safe as they needed to be. It was best to stop driving before I had an accident and possibly injured someone. Yes, I forfeited that feeling of independence, but I am still able to get around. Now, though, it is based on a fixed timetable on the bus or SkyTrain or by taxi cab. Is that frustrating? You bet. Now it's, where are you going? Or why do you want to go? On a good day, that seems unnecessary and personally intrusive. On a bad day, it's totally justified and safe. And that's the split personality of dementia. Good day equals independence. Bad day equals support. And for those around us, this is an ever-changing landscape of eggshells. I was diagnosed at an early stage, and one thing an early diagnosis gives you, though, is control. Control over an orderly transition of your affairs, for example. For myself, I know at some point down the road, I will be unable to manage my own affairs and will need help. So getting an early Alzheimer's diagnosis lets me plan for the future, while I can still have a say in my future. And that is what I have been trying to do overall. Be proactive and be in control. An early diagnosis of Alzheimer's or related dementia can offer early treatment that may stabilize or slow the rate of decline. You get a chance to be educated on the disease and learn, for example, that socialization and physical activity like walking are excellent programs. Some of us will also use this opportunity to educate. We can increase awareness of Alzheimer's and related dementias and what it is like to live with this disease. You know, there is a lack of awareness and even a misunderstanding in the community at large about Alzheimer's and the related dementias. There is even a stigma associated with our disease in some quarters. So this is our chance to share our story and to educate. We know this story, but others don't. And if we don't tell the story, our story, who will? If we don't advocate to educate, then how do we shatter the myth or break the stereotype? Who listens? Well, our family, friends, and neighbors do. We also spread the net of awareness to the broader community. And government can't help but hear that. Who cares? We all do, or at least we all should. Everyone needs to hear about Alzheimer's and the related dementias. They need to be inspired to learn about brain health and the things they can do for the good of themselves and, of course, their brain. Hearing our stories will hopefully lead to wanting more information on research and how the course of this disease might be altered. Perhaps by our actions, government will be encouraged to invest significantly more into this critically important activity. We can hope. And we can keep educating by taking advantage of what I call teachable moments, like this, today, for me. So thank you all for attending this press conference and listening to my story as a 61-year-old person with Alzheimer's.
Thank you, Jim, for that important perspective. Our next speaker is Gerry Matier, who is this year's Vancouver's honoree for the investor group Walk for Memories, which takes place this January 31st. His wife, Dee Dee, was diagnosed with dementia in 2001 at the young age of 49. Gerry represents the many thousands of family caregivers in BC who face a demanding and sometimes very difficult journey requiring hard work, patience, and compassion. He joined a caregiver support group with him to gain understanding and regain focus. He also gives back to other caregivers by sharing knowledge, experience, and the story of he and Dee Dee's journey. Gerry?
Good morning. It was actually 10 years ago on New Year's Eve. I was thinking last Thursday night that it was Y2K. My wife and I had gone back to Winnipeg. We were celebrating Christmas with her family. And I remember thinking on New Year's Eve that we had it made. We both had good jobs. We had done well. We were very happy, and we seemed to have the life in front of us. 3 months later, everything changed. I started to realize there was differences. She was facing challenges. And those challenges, we went through about a 1.5 year odyssey of doctors and appointments, and early 2001 we were told that she had something called frontal temporal dementia. Didn't know what that was. I always thought there was just Alzheimer's. When we had been going to the doctors, we had been told there was other possibilities, but her memory was always intact, so I knew it wasn't Alzheimer's. I didn't realize there was 80 some odd other dementias out there that you can also get. And it turned out she got one. There was no history in her family of it. What I learned was the date the doctors told me what the illness was, they said she has frontal temporal dementia. You need to look into things such as power of attorney. You need to get her driver's license removed, and my wife liked to drive, so that was a hard one. And a number of other things. And I left there going, what illness is this? That was my first dealings with the Alzheimer Society. I went onto their website, and lo and behold, they had all these different dementias available, and I read about it, and when I read it, it was pretty clear that that's what Dee Dee had. It affected her left side of her frontal brain, which involved her communicative functions, speaking, reading, talking, any kind of cognitive function, and that was clearly evident. Dee Dee was very articulate. Before she got the illness, she read a lot. It was her lack of articulation that was the first clue to me. The second was the fact it was taking her forever to read books when she would read a book a week. At that point, everything changed for us, probably more for me than her. I don't know. I never did really understand how much she grasped of the illness once we learned what it was. What she started to do, though, is she started to regress in some ways, and in other ways, things stayed intact. At one point, I referred to Dee as my 12-year-old with 50 years' experience. And it was a good indication of it. Her memory and the things of her memory worked for her. She could be extremely intuitive in some ways, and in other ways, completely lost like a little child. And I'll give you a great example. They have a test that doctors give for people with dementia, and there's a number of different things you have to do, and one of them is you have to count back from 100 by 7. So when I asked the question, this was her third or fourth time, she'd seen the doctor, they asked her the question, and she got to 93 and then hummed and hawed and couldn't get it, and the doctor was encouraging her. She leaned back, reached in her purse, pulled out her glasses, leaned forward on the desk, and then proceeded to read the numbers off of his sheet upside down. And I'm sitting there going, you're pulling my leg here. And yet at the same time, and within a very short period of that time, we had a grandfather clock, and this shows you the dichotomy of how this all works. A grandfather clock. We were in bed, 11 o'clock, the clock chimed. She looked at the clock beside the bed and said it said 11:02. Hopped up, went downstairs, changed the clock to 11:02, came back up. Of course, when she came back up, it's 11:04. So down she went again to change the clock. And this went on, and I'm thinking, okay, no, the clock's fine. I could not explain to her the issue. The ultimate solution was to unplug the clock. And then I plugged in the next day, and I forgot about it. It happened again the next day. I fell asleep. She did it for an hour. This is the same person who, like a week before, could sit there and read the answers off the back of the sheet. She used to study for that exam. I caught her one day with a calculator, sitting there, 100 minus 7, 93 minus 7. It was amazing how the disease functioned in her brain. But unfortunately, at the same time, a lot of other things were not working, and it was becoming more challenging for us. And from my standpoint, so starting in 2001, I then became a caregiver. I certainly wasn't prepared for that role. I don't think anybody ever is. It is very difficult to sort of watch somebody go through an illness like this. I was very lucky. I was very lucky because I had the support of friends and family. Dee Dee's sister, who lives here, Donna, probably did as much of the caregiving as I did from 2001 through to 2006. Our friends were so supportive of us and were always there to sort of help me and take time with Dee Dee. I was very lucky. I had a job. My employer was extremely supportive. My staff covered for me. I was kind of surprised they didn't kind of figure at one point, why do we have him around here anyway? But all of these things are what went together to make it possible for us to care for Dee Dee. And it was an us project and continues to be. Dee Dee eventually had to go into care for a number of reasons, just it was not possible to keep her at home. And that itself was another surprise. I really had not planned on that, expected that. I thought I would keep her at home, and that didn't come to be. But anyway, it's been an amazing journey for me, an amazing challenge. I'm so thankful to all the people who've helped us, and I'm hoping that in the future things will come together and people will not have to take this journey as often as I've had to take it, and other people, thousands of people. You saw 70,000 people in this country. You got to figure that there's probably 3 or 4 caregivers for each one of those people minimum who are going through this challenge. So anything we can do to prevent that kind of journey for somebody else down the road is a good thing. And thank you very much.